Our team presents to you a point-of-care microfluidics device for early detection of oral cancer. The burden of oral cancer in India is very high, and this is particularly due to the widespread use of tobacco products, betel quid, and BDs and cigarette smoking. The leading causes of death for cancer in men and women in India are oral, stomach and lung in men, and cervical, stomach and breast in women. Many factors lead to delay in diagnosis of oral cancer. The factors that play a role are tumor biology, the behavior of the patient, the healthcare systems, and healthcare providers. What we would like to do is provide an aid for healthcare providers at the point of care in a primary health setting to be able to detect oral cancer at an early stage.
So overall, we'd like to create a device to sense, capture, and quantify the hypermethylation of EDNRB. EDNRB is a validated biomarker for oral cancer and pre-malignancies and malignancies. We'd like to achieve quantitative results, investigate degradation of DNA, and really focus on the time span and cost effectiveness when we design this device.
So this is the prototype of our device. It's got three main modules. It's got a cell capture and lysis module, a PCR module, and a DNA detection module. So the cell capture and lysis is essentially this part of it, and for cell isolation what we're doing is a size-based filter, a wire filter. Essentially you have a very small gap right here to allow fluid to leave, and that gap's going to be less than 10 microns. Cells, which are about 30 to 40 microns in diameter, can't go through that, so you're isolating the cells inside this chamber. Now when we go to cell lysis, what we're going to be doing is using mechanical forces caused by magnetic beads. We're going to put magnetic beads into the chamber, put it on a stirrer so that it starts spinning the magnetic beads. And based on the collisions between the beads and the cells, we're going to rupture them, causing them to release their DNA.
Alright, next, so in the same module, we are actually going to do bisulfite reaction to sense the presence of methylation. And the way we're doing it here is simply by trying to introduce agent that will mutate C into U, but this mutation will not happen if that nucleotide is methylated. And after we do that, we want to be able to amplify the sample so we can sense it in later analysis in other part of the chip. And we are going to circulate the sample through hot plates of different temperature to mimic the protocol of polymerase chain reaction.
So after we amplify all the DNA, we like to actually run it through alkaline solution to negate all the bisulfite reaction effects. And then in our chamber, we'll have a high temperature region where we're going to actually denature part of the DNA, and then we're going to have it run through a lower temperature region so that way it can hybridize with your cDNA probes. And we're going to have it, if we see a colorimetric change in the assay, then we're going to, it signifies that there's high risk of oral cancer.
The future direction for this prototype is laboratory validation first, and then in phase 2 clinical validation on the field using salivary samples. Thank you.